COVID-19, of course, has had a devastating impact on our lives and our economy. Here in South Africa, at least 45,000 people have died from the virus in less than a year, and that is a conservative estimate. A look at the excess deaths suggests it could be as high as 100,000 deaths. But there has been a knock-on effect of COVID on other serious diseases. We must remember tuberculosis is still a major killer in the country. And today, the TB Prevalence Survey, conducted by the Human Sciences Research Council, was released by the Health Minister as well, highlighting many challenges that lie ahead. And I'm joined now by Professor Salome Charalambous, Deputy Chief Scientific Officer at the Aurum Institute, a global health research organisation. Good evening, Prof. Thank you so much for joining us. So how many people die of TB every year in South Africa?
Hi, Sally. We have around 30 or 30,000 people that die per year in South Africa of diagnosed TB. But of course, a big part of the prevalence survey was to try and estimate how much undiagnosed TB there is and whether the number of cases that we're identifying are the true burden of TB in South Africa. And that's why these prevalence survey results are so important for us to understand the true burden of TB in our country.
I read that the report found there are many people with undetected TB and that people with TB symptoms delay getting help. It also found a higher proportion of HIV-negative people have asymptomatic tuberculosis, higher than people living with HIV. And the Health Minister is saying that means, because we've got a lot of asymptomatic cases, everyone needs to be tested. Would you say that's the key finding to come from this prevalence survey and perhaps the biggest challenge?
Yeah, I mean, I think it's important. I think that one of the biggest findings was just that people don't seek care. So even of those who had symptoms, only two-thirds had not gone to look for assistance. And that is one big finding that, we can actually help. We can educate our public and make sure that they do seek care. So that's an important finding. The asymptomatic TB is an important finding. It talks to us having to put other measures in place to find TB. There are, of the people who were identified, a large proportion were positive on chest X-ray and may mean that we have to increase the use of chest X-ray in our country. We only have them available at the moment in large clinics and in hospitals, and we possibly have to invest more in digital chest X-rays and use them more to find TB cases. In addition, I think the other big finding of the prevalence survey is that we are continue to miss TB in men and in our elderly population. And so more measures need to be put in place to find men with TB, possibly making TB screening available at workplaces, increasing clinic hours so that men who are working are able to access care, and to increase the friendliness of our facilities to men. And all those are measures that can be put in place.
Has COVID-19 negatively impacted TB detection, screening and treatment at all? Because there was such concern before the virus hit, and obviously lockdown meant people weren't going to clinics. But has it been as bad as everyone thought it was going to be? Or has it been worse?
Yes, unfortunately, it has been as bad as we thought it was going to be. So over the period April to around October, we had a reduction in the number of TB tests as were identified by the National Laboratory. So we had a reduction to around 30 to 40% of the tests that were being done in the previous year during those months. So we know there is a big gap now in TB testing that has taken place. People were reluctant to go to clinics. People were reluctant to seek care. And, I mean, they could be part of the reason for those excess deaths as well. So we are very concerned as a TB community that TB has really, really taken a back seat and hasn't been given enough prominence and importance, and that we now have to do a major catch-up to try and find the TB cases that have not been identified. So there are a number of measures that were also, some of them were spoken about by Dr. Mkhize this morning, and we are working quite hard to try and put those measures in place to find those missing TB TB patients.
What is your advice to the individual? Should every South African get a TB test just in case? What is the advice to the individual?
I don't think it's going to be possible for our health service to deal with every South African having a TB test. And we've already seen how difficult it is to get the amount of COVID testing in place. I think it's very important for those who have symptoms of TB, which are cough, weight loss, night sweat, to make sure that they have a TB test. I think it's also important for all people who are tested for COVID to also have a TB test at the same time. But I don't think that it's possible for every single South African to go, and it will completely overwhelm our laboratory service and our health service at the moment.
Yeah, but such important advice that if you are displaying those symptoms, do go and get a test. If you get a COVID test, ask for a TB test as well. Thank you so much, Professor Salome Charalambous, Deputy Chief Scientific Officer at the Aurum Institute, a global health research organisation.